Thank you, Mr Speaker, and it's a pleasure to be able to rise to address the motion and the amended motion. It's a pleasure to be able to follow the member for Waterford. And I thought after her performance during question time, her protests, which were quite loud and vociferous, that she might have led by example and repudiated the actions of the member for Cairns, which she has clearly repudiated like similar actions in the past. She had an opportunity. She made the point during question time that she didn't have an opportunity in question time. Well, now she spent 5 minutes on her feet speaking about standards. And I'll quote her. Her words, a lack of leadership.
Point of order,
a lack of leadership.
Point of order.
My point of order is relevance,
Member Springer.
Mr Speaker. My point of order is relevance.
I can't hear Member for Springwood. Point of order. Thank you.
Sorry, Mr Speaker. The point of order is on relevance. The Minister must be relevant to the motion or the amended motion.
Yep. Fair point of order.
Mr
Member
Speaker.
for Buderim, you have a motion.
Thank you, Mr
in front of you.
Speaker. And I will rebut the contribution of the member for Waterford, who said that, quote, this was the biggest lack of leadership. Quote, we needed to lead by example. Her words, not mine. I agree with them, incidentally. There is a lack of leadership in this House tonight, and it comes from those opposite. The member for Cairns should be condemned for his actions, and for those opposite to come in here and ignore them says everything Queenslanders need to know.
Sit down. Point of order.
Point of order, Mr Speaker. Point of order, Mr Speaker.
What is your point of order, Member for Springwood?
Apologies, Mr Speaker. My point of order is in relation to relevance. Just a moment ago, you ruled on relevance and instructed the minister, and he intentionally ignored your ruling.
Okay, I've got you. It's relevance. Did you have point of order or not, Member for Mogul?
Well, my point of order, Mr Speaker, was the outburst from the manager of opposition business was unbecoming. That's my...
Okay. Member for Buderim, you've made your point on that issue. We are debating a motion. If you could bring yourself back to that, I would be appreciated.
Thank you for your guidance, Mr Speaker. Mr Speaker, so it begs the question, why have those come in here and chosen to seek to distract from their record when it comes to health, seek to distract from their record when it comes to standards of public behaviour, Mr Speaker? The simple fact is that Queenslanders are living with a decade of Labor failure. 10 years of Labor failure when it comes to health. The worst ambulance ramping in the country, presided over by those opposite. And it begs the question, who has the most to lose from a conversation about Labor's record when it comes to health? Could it be the now opposition leader, a former member for health, Minister for Health? Could it be the now deputy opposition leader, a Minister for Health? Could it be the next opposition leader, the member for Waterford, a former Minister for Health? They have all presided over a decade of failure. And it's Queenslanders who paid the price, Mr Speaker. Whether it's ramping, whether it's the outpatient wait list, the reality is those opposite failed Queenslanders. In my own electorate, I brought the plight of Daryl and Stephanie Massey here to the Parliament in 2022. Stephanie had a fall at home. She'd broken her hip and her femur. She sat ramped for 5 hours when she should have seen emergency treatment immediately, given the nature of her industries. Daryl, her partner, was a victim under 2 Labor failures in the health system. He too sat ramped for 7 hours with a huge haematoma. And I can hear those opposite interjecting. In fact, the member for McConnell, when I brought one of the stories of a victim of the Labor's health crisis, said that I was coming in here and, quote, making things up. Well, I can tell you, Mr Speaker, the people of Buderim, the people of Queensland know Labor's record when it comes to health. They know that those opposite want to hide from their record, which is why they come in here and they move these motions which are full of baseless allegations, assertions without facts. Those opposite know that their record is shameful and they are ashamed of it, and they should be. Queenslanders passed judgment of that in October last year. Mr Speaker, I want to contrast the approach of those opposite, people like the member for McConnell, who says we come in here and make stories up. People like the member for Waterford, who failed to take responsibility, promised she'd bring the ambulance ramping down. I think to 28% was the number. Failed, 45.5%, under the member for Waterford. Worst, I take the interjection from the member for Mudgeeraba, the worst health minister that Queensland has seen, with the worst ambulance ramping in the nation. Contrast that with the approach taken by the now Minister for Health, the member for Clayfield. When confronted with questions today in relation to the plight, I think the Queensland, I think the individual's name was Droon. An empathetic response.
Member for Miller, member for Chatsworth, cease your quarrelling.
Commitment to action to address the concerns. Mr Speaker, that tells Queenslanders everything that they need to know about our government's focus on delivering. 10 months in government, and we have delivered more than those opposite could over a decade of Labor failures. The people of Buderim know it, Mr Speaker, but every Queenslander passed judgment in October, and those opposite should listen to Queenslanders' voices. Mr Speaker, that is why I will be supporting the amended motion, and I call on all members of this House to reject Labor's scurrilous attacks and scare campaigns.
Speaker's time has expired.